The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are taking pediatric cases and challenges and looking at them with a different perspective, one that includes critical thinking. We're not afraid to ask the tough questions. And I have back today a very special guest, Dr. Michael Gaeta. Thank you for coming back on our show, Dr. Gaeta.
Great to be with you, Paul, as always.
Yeah, your last episode was like, wow, that you touched on so many huge issues. You have 36 years of clinical training and experience in Chinese functional medicine. You're a practicing dietitian, nutritionist, herbalist, acupuncturist, and you have your own weekly podcast on natural health and health freedom. So it's a real pleasure to have you back to just educate us on a couple really important topics today. I wanted to cover preconception care. What should parents who are thinking about having a family, what should they do ahead of time?
Yeah, that's a great question, Paul, and I'm one of your biggest fans, so it's an honor to be with you
Thank
today.
you.
In Chinese and natural functional medicine, the principles are similar. The first thing we want to do with a couple who's looking to conceive, and we need more of that these days, got to get our birth rates up, is the basic strategy is to clear and then build. So what does that mean? With the toxins in the environment, in our food, air, water, it's very important to detoxify endocrine disruptors, things that might be interfering with fertility, and do some type of purification type of program. And there's many different ways to do that. We have a way that we do that at the clinic and the school, but whatever you do, to give your body a chance to get rid of bad stuff, harmful chemicals.
I'm not in the conceiving world anymore. I've been there, done that.
Yes.
But if I was listening to you say that, I wouldn't know where to begin.
Yeah.
Other than drinking really good water,
Yes.
that I know is important. But how do I detoxify? I mean, I've got this lifetime of
Yes.
poor choices that I've made, and
Yep.
now I'm about to conceive, or I'm hoping to conceive. How do I detox?
It's a big subject, but the basic idea is to eat a clean diet, meaning free of processed foods and sugars, coffee, laying off the caffeine, added sugars, and eating a whole foods diet, ideally with intermittent fasting. So where you eat all your food within 8 hours, just have water the other 16. And at some point, after you're comfortable with that, I recommend to my patients doing this once a month, an extended fast of 36 to 72 hours. A lot of cleanup happens in these fasting periods where the body just sort of does a lot of house cleaning itself, just like the sanitation department comes once a week to take out the garbage.
Eating clean, I presume that's eating organic.
Organic is important.
Okay, because I know glyphosate's really bad for us, and there's other pesticides they use.
Yes.
But I'm a little concerned about the fasting if I was pregnant.
Well, you're not eating less, you're just eating less often in an intermittent fast. Now, I do not recommend extended fasting, which in my practice is 36 to 72 hours. I have students that'll go 2 or 3 weeks. I don't recommend that. Certainly not for pregnant women. No extended fasting when you're pregnant. You're still eating all your food. You're just eating it less often. You're compressing your eating window into 8 hours. And that's entirely safe for pregnant women. And with pregnant women, we're a little ahead of ourselves. I do recommend they get in at least 100, closer to 140 grams of protein per day. That's a very good way, by the way, to prevent preeclampsia. So anyway, preconception, the detoxification, and there's a lot of other things to do that are more specialized, whether it's herbs like milk thistle and schizandra and rosemary and turmeric, all these herbs, for example, that support detoxification pathways. Foods like beets, for example, are great. Sour foods break up congestion in the liver and gallbladder. things that help the body get rid of toxins. Again, there are 5 organs of elimination: liver, kidneys, skin, lungs, and gut, colon. So there's different ways to support those different organs. And then things like saunas and exercise and PEMF therapy to improve circulation and drainage. There's a lot of ways to do things in addition to the clean organic diet. Those are the basic ideas. But I do recommend folks work with a practitioner who's experienced in guiding a cleanse if possible. If you can't and you DIY it, that's perfectly fine. But just do something to help rid your body of accumulated chemicals.
If I wanted to detox and I'm not pregnant yet,
that's the idea.
Can you help me do that? Where do I go to find that help?
Yeah, so we have a self-guided cleanse in our school, which is very specific. It's a 5-week course, and there's a 3-week cleanse in the middle of that. So you can self-guide with specific herbs and specific diet and specific. We have all the details at michaelgaeta.com, and you click on courses, and then you'll see transformational detoxification, which is a mind-body cleanse. And we published a book called Fast Media Fast, because part of the cleanse as we do it is disconnecting from all mainstream media for those 3 weeks, those 21 days.
I love that. That is wonderful.
It is wonderful. I'll tell you, Paul, that's the thing that people notice the most. I like, because at the end of the cleanse, when I'm guiding patients through, like, how did it go? They're like, the thing I loved the most was not looking at the newspaper, no internet news, no social media. I just disconnected from all that stuff. I just read books, or something like that, or I did an audiobook or something like that, but no mainstream media for 3 weeks. And that's the thing that sticks with people, in addition to the dietary changes that we do. That sticks with them. They're like, I'm never going back. I'm thinking better. I'm happier. I'm more peaceful. I'm less fearful. My whole life quality has improved.
Yeah. Fear is a toxin. And I'll tell you, the media just pounds messages that heighten fear. I remember one Father's Day, I was sitting in my living room with my kids. I have a bunch of kids. And they were all on their phones. And I thought, well, I'm just going to sit here and see how long it takes for them to acknowledge that their dad, it is Father's Day after all. How long will it take? But you know what? They weren't going to get it. It was not going to happen. So,
wow. Well, how long did it go?
Oh my gosh, it went on for 15, 20 minutes. It was just like,
wow.
I was ready to scream, but I didn't. I'm glad I didn't. A subsequent Father's Day, I made a policy, a trial. I said, you're welcome as long as you don't bring your cell phone.
Oh, nice job.
If you do bring it, you need to turn it off. Yeah. And I had one child who couldn't come because they were working.
Okay.
And they needed to be on their phone. Which was like, okay. It was a Sunday, I believe. I don't know.
Oh,
all
wow.
Right. But anyway,
well,
thank you.
Good policy.
Thank you for that reminder to disconnect. That's an important one.
Yeah, the media fast is part of the cleanse.
That's beautiful.
Yeah.
The second part of our talk today, and you can just run with this however you wish.
Yeah.
We want to create a future for our children, kind of how do we go about setting the stage to have healthy kids?
Yes, that's great. And I got to finish the second part of your question, Paul. It's detoxify, but then build. In Chinese medicine, the most important thing is the health of the parents at the time of conception. That's the constitutional endowment. There's no genetics in Chinese medicine, but there's energetics. And so the energetic vitality of both parents at the time of conception is the most important determinant of constitutional resilience for the whole life. So I try to get the parents in really good shape, and that after that cleanse, that detox, clean up the diet, all of that, we build. So this is animal foods, animal fats, healthy protein, again, organic, pastured, grass-fed, plenty of fruits and vegetables, and strengthening building foods, bone broth, bone marrow, meat stock, all of these nourishing eggs, a dozen a week at least, fortifying, nourishing, building foods so that they're in very strong shape before conception. Second most important thing is the health of the mother during the pregnancy. And there's no cleansing or detoxing then. It's all build, build, build,
Build,
make the
build,
mom
build.
strong. And remember, the baby has to store before it's born in its liver about roughly 6 months of iron, because babies can't really absorb iron for their first 6 months, even breastfed. So the mom has to make sure her serum iron is 80 to 150, ferritin is 80 to 150, she's not anemic. Her red cells are at least 5, hemoglobin at least 15, hematocrit at least 42. We've got to have strong blood and plenty of iron in that mom so that
Wow.
she has lots to give to that baby before birth. And I'm a big fan, this is a Chinese medicine thing, of going full term when possible, and not to schedule, the C-section kind of
Right,
nonsense.
right.
Natural childbirth full term is really ideal because that gives the mother as much time as possible to feed that baby the nutrition, including the iron, to have before it's born.
Wow. I caught something there that hopefully our listeners caught, and that is this detox process, this whole preparing preconception care is
Yeah.
for both parents, right?
Yes,
So
yes. Good
you're
point.
encouraging dads and moms to go through
Yes,
this process,
absolutely.
and that's beautiful because that's kind of unifying as well, right? If you're
Yes.
doing something together.
Well, it's
Um,
just like the cleanse. Like you don't want just the mom doing a detox. You want the dad doing it too, partly because they can just prepare food once, right? So they all eat the same food. So it's good to do it together as a couple.
I love that. So we're blessed, we're pregnant. Now what?
Yes. Well, that's prenatal. And prenatal is very important because the care of the mother during pregnancy is the second most important factor in the constitutional health of that child from a Chinese medicine perspective. And so that mom, needs to be well rested, great sleep,
Mm.
stay gently physically active. I'm not a big fan of like CrossFit during pregnancy, but mild to moderate exercise, getting time outside in the sun every day. This is for everybody, by the way. But 30-minute walk outside every day or something like that. But staying physically active, eating a clean diet because you're eating for two, as the old saying goes. Whatever you put in your body is going into that baby. And so just be really careful about that. And then you're set. And then there is some basic supplementation that's very important to optimize the health of the mother, including iron. The RDA for iron during pregnancy is 41 milligrams, and I think that's sort of a minimum. And there's a lot of other nutrients that are really important. B vitamins during pregnancy, clean, organic grass-fed organ meats like liver, heart, things like that are very helpful. In addition to the more, commonly eaten eggs. Eggs are the perfect food. Eat the whole egg. Most important part is the yolk. And at least a dozen, at least a dozen, closer to two would be better, eggs per week during pregnancy. So we need a well-nourished mom, plenty of animal fats, plenty of animal foods, grass-fed beef and bison, organic poultry, all that good stuff is very strengthening for the baby. So a full fat, healthy fat diet.
I have a
Yeah,
daughter-in-law who's pregnant right now, and she
yeah,
has a aversion to meat.
yes,
She
yep,
can do eggs, so that would be a good choice for her, but
yeah.
she just can't even look at meat.
Can't even look at me. Yeah, there's two reasons for that. One is a B vitamin deficiency. The other is very low stomach acid, where the body sort of doesn't want it because it knows it can't digest it, even though animal protein is easier to digest than vegetable protein, because
Hmm.
animal protein is pre-digested vegetable protein, right? So the cow's eating grass, ideally, and then
Right.
digest that vegetable protein or for you. So drinking that raw organic grass-fed milk or eating that grass-fed beef, you're basically consuming pre-digested vegetable matter. So for the daughter-in-law, you still got that protein requirement. And I've heard this from students of mine who are midwives. I've heard this, over the last 30 years, 33 years of my teaching. They always say the same thing, 140 grams, certainly starting by the second trimester, if not all the way through pregnancy, of protein intake per day. So she's got to figure it out. If she can eat eggs, great. Have 2 dozen a week. Could be more, whatever, as much as she enjoys. If it's too much, leave out the white, just eat the yolk. And then find other ways to get the protein up. Poultry, maybe it's just a beef problem. Organic pork products, whatever. Try to get that animal content in. Grass-fed butter. These are all very important things to consume. And yeah, in a last resort, you might need like a clean protein powder or something like that. It's not ideal, but if that's what it takes to get you to that 100 to 140 grams, then I would do it.
During pregnancy, are there things I should not do?
Yeah, other than the obvious like alcohol and cigarettes, and not a huge fan of coffee during pregnancy. It's a neuroendocrine stimulant, maybe once a week. And just eating a clean diet, and not over exercising. You want to not overdo it, so to speak, meaning you exercise and then you're completely exhausted, right? Exercise should be invigorating, not exhausting. If you're exhausted after exercise, you did too much. So those are some things not to do. And I would just be, mindful of EMF exposures, in general. But during pregnancy, not have that cell phone anywhere near the baby. During pregnancy, put it in your purse or in a handbag or something like that, so that you don't have close proximity of EMF to your belly. I think that's kind of an important thing. And just like for the dads, get that cell phone out of your pocket, right? For example, you don't want it near the family jewels. There's quite a bit of research, not 100% of the research, there's some conflicting research, but the bulk of the evidence suggests adverse effects of cell phones to sperm counts and testosterone levels. Gotcha. So good idea to try to turn off the Wi-Fi at night when you're asleep. You don't need it. Things like that to try to minimize EMF exposure, simple things like that are very helpful. If you're going to have the phone on you, have it in airplane mode. Just turn it on when you have to make a call, that sort of thing, are very simple things. And just enjoy the pregnancy. Again, I haven't experienced it, but, obviously, but it's a sacred time, and treat it that way, not as like a chore or an annoyance. It's a sacred event, something that is just even though it can be hard for sure, but it's something that is, can be a beautiful experience.
So my OBGYN is saying I need a Tdap, I need a COVID shot, I need an RSV shot, and I think there might even be another one. It's like I'm not feeling really so sure about that. What do you think?
Yes. Well, thankfully, we have several thousand years of moms birthing healthy kids without those things.
Thank goodness. Okay. Here I thought that was the only way you could have a healthy kid.
Yeah, and by the way, they did not do. Obviously, none of the vaccines have been properly safety tested within their placebos, but they've never, ever done proper safety testing on any of these vaccines, long-term outcomes with pregnancy. And so, they're just making stuff up when they tell you it's safe and necessary and effective, as is usual in the whole vaccine field. They will commonly just make stuff up and say it's science, say it's evidence, without it actually being there. I think it's very important to avoid all vaccinations in general, period. The only healthy number of vaccines to have is 0, to really avoid that during pregnancy. It causes, my experience, and the literature suggests possibly greater harm than good with vaccines during pregnancy.
Okay. My OBs also tell me I should take acetaminophen. I get headaches,
Yes.
and they say to avoid ibuprofen, but to take acetaminophen.
Yeah. Well, the NSAIDs are, always going to be potentially toxic to the liver and kidneys, impair or weaken the gut lining, contributing to intestinal hyperpermeability or leaky gut, making autoimmune conditions more likely. So there's a lot of natural solutions, like simple things like calcium, magnesium, that are safe for pregnancy and can be very effective, as well as herbal teas, like even some of the pregnancy teas, like yogi tea or any of the prenatal teas that are based on red raspberry leaf. These often, I've seen this firsthand with patients, are great for headaches. So there's plenty of natural headache remedies. Even something simple as chamomile tea, ginger tea can be very helpful for a lot of these complaints of pregnancy. You want to try to go drug-free during pregnancy, just like you want to go organic with your diet. And when we look at causes of childhood illness, there are 7 main ones, and one of them is vaccinations.
I totally distracted you from our second question
It's okay.
for the day. Nourishing the future of our children's health.
Yes.
You've got 5 minutes left to give us all your wisdom on this topic.
The way we get to this is to understand the main causes of childhood illness. And then we get to what I call the eightfold path to childhood wellness. So the main cause of childhood illness, number one, is the diet. The most highest sugar content of any population in history are American teenagers, just as an example. So we've got to get the sugar, we've got to out of the diet. Added sugar, not naturally occurring like in fruit, is fine, but we've got to clean up the diet in the moms and while they're pregnant and breastfeeding, which is really important. And by the way, most important thing for healthy childbirth is not to have an OBGYN. With all due respect to them, they are not trained to let nature take its course. The best thing you can do to have a great birth experience is to get a midwife and optionally a birth doula. There's different types of doulas, a birth doula. And with my son, who's 21, there's 100% chance his mom would have had a C-section, if not for having one of the best midwives in Manhattan, that the doctor who came to the door 3 times to say, we're going to take the baby we're going to take it to the OR and quote, take the baby with C-section, that would have happened. So really important to get a midwife. Best way to have a baby. Again, OBGYNs have their place. They have certainly for sure, but they're not good at waiting. They're good at intervening. Like you're a physician, you're trained to do stuff, right? Mm-hmm. I know how to do this. I know how to do that. I can do this procedure. I can do an episiotomy. I can do a C-section. I can do. That's not childbirth, right? That's intervention. Right. Childbirth is not a disease that needs interventions. It needs a lot of enfoldment and care. So a midwife in a birthing center is ideal. That's what we did with both our kids, a birthing center in a hospital with the OR with a dedicated elevator, literally 2 minutes away in case there was an emergency. Their mom was 38 and 42 when she gave birth to the 2 kids 4 years apart. So we felt more comfortable being in a hospital, but a birthing center within the hospital. But otherwise, just a birthing center with a midwife is really ideal, extremely important.
Very good point. My mom was a nurse midwife. I've looked at the data, and if you go with home birth or a nurse midwife attended birth, yes. I think the chance for a C-section is 3 to 5%. Yes. Whereas if you go with the OB route, it's 30 to 35%.
Yeah, it's a third of all births are scheduled C-sections. It's horrifying, and it's so bad. And just one note on that, Paul, you really want to have a normal vaginal delivery. Even after prior C-section, it is possible, because that maternal ancestral transfer of healthy microbes in the birth canal, the baby goes through the birth canal with its mouth open, ingesting vaginal flora in the birth canal. That is its moment of ancestral transfer is really important to the lifelong health of that child.
Wow.
And if it is a C-section, what the midwives that I've trained recommend, the natural midwives, and I had a CNM also, certified nurse midwife, while the baby's breastfeeding, they'll take some vaginal mucus and feed it to the baby, just to try to get some microbiome buildup in a baby who was born C-section. So that's really helpful. And ideally, breastfeeding, as their mom did for 3 years, or as close to that as you can, is really incredibly helpful. And ideally, just stay home and be a mom and be with your baby. Really, if possible, don't go back to work for a while. Their mom, was a high-powered Manhattan attorney, and stayed home for a year and a half in both cases. And and I just had to, step up, hustle, find to make it possible that she didn't have to be a lawyer for a year and a half. And that was wonderful blessing for the kids to just be with their mom all day, and that was a wonderful thing. So I think that's definitely ideal. Women going back to work after 6 weeks, it's just such a tragedy. You're paying somebody else to raise your baby. I mean, it's horrible. But anyway, I understand there's individual situations. So main cause of childhood illness: diet, lack of exercise, too many screens. The average American kid gets between 7.5 and 10 hours of screen time per day. If you count multiple screens, it's close to 10 hours, where they'll be on their phone, but the TV is on, right? Or they're on their computer and they're on their phone. So they're getting 2 screens at once. So there's just too much screen exposure. A lot of countries are taking action on this. Neurodevelopmentally, it's ideal not to have screen exposure, and this sounds crazy to every American, until puberty. The brain is not developed enough to filter out stuff, and that flickering 60 or 75 hertz screen is a lot of stimulation. We can't track it because it's flickering so fast the brain can't detect it. But that's the babies their brains have not developed defenses against flickering screens, not even counting content and the EMF. So too much screen time is just a bad idea. No screens, as close to puberty as you can. Chemical toxicity is huge. This has to do with having a water filter, eating organic food, avoiding plastics and aluminum cans as much as you can. There's a lot of endocrine disruptors in the environment. Vaccinations, easily the greatest cause of childhood illness. Over medication. 1 in 5 American kids have been prescribed a psychotropic drug. That's horrifying. So that really should not be. And then a frequently overlooked 7th one is a lack of warmth. Emotional warmth, but also physical warmth. If children are not kept warm, particularly like young children, they're growing so fast that if they're cold, their resources get diverted away from growth just to stay warm. So having that silk wool cap on, and feel the kids' hands. I was constantly feeling my kids' hands when they were little. If the hands are cold, the kid is cold. And children's hands should always be warm. And if they're not warm, they need more insulation. And if you're concerned about overheating, just feel the back of the neck. If they're sweating back here, they might be overheated. Otherwise, they're not overheated. Kids need warmth, physical as well as emotional warmth. And you just have to stand up and be the parent, hey, this is what we're doing, and not let the kid decide what they're going to wear to school, at least in those early years. They need to stay warm. It's very important for proper development. So
that is wonderful. What a great summary. You did it in 5 minutes.
Oh, yeah. And basically, the eightfold path to childhood wellness is based on that. So it's all that thing. The only thing I didn't mention was lots of outdoor physical activity, unstructured time for imaginative play. That was a great blessing. My kids were in Waldorf for 12 years, all the way up until high school, when they went to a public school. But that unstructured time, I think parents want to just structure every minute of the day. Particularly the younger ones just need time to just imagine and daydream and just figure stuff out. One of my favorite things, the kids would say, "Daddy, I'm bored." Good. And just let them be bored. And then within 5 minutes, here's some blocks. Here's a truck.
Right.
So they figure it out. But let kids have time for unstructured, unfocused attention. Very important that kids have imaginative play.
Beautiful. Were you referring to a book or something on your website?
Oh, it's a course. We have. I think it's on the website. I hope it is on children's health. But it might be in our vaccines and immune system course. Also, we have a free course called Vaccines and Choice. Free course with our mutual friend, James Lyons Weiler, other folks, Alan Phillips, others have contributed to this course. It's free, and it's at our website, michaelgaeta.com. Then just click on courses, go to vaccines and choice. And we have a special page for your listeners, michaelgaeta.com/CHD for Children's Health Defense.
Thank you, Dr. Gaeta. You are a wealth of information. It was so great to have you back on the show.
Always a pleasure.
We're going to have to do it again sometime for sure.
Love to, Paul. You're awesome. Appreciate you.
Thank you so much. And thanks for watching. I'm Dr. Paul, your host. I look forward to seeing you next week. You can find me at kidsfirstforever.com.
We're live. Okay, tell us your name, please.
Jennifer Diamond.
Okay, this is about you having these horrific injuries from Pfizer. Now, how many Pfizer shots did you get?
I had the first 2.
Okay, can I ask you why you decided it was a good idea to get a Pfizer COVID-19 shot?
I didn't think it was a good idea. I actually was very hesitant, and I had 2 of my daughters that became pregnant 5 weeks apart from each other, both high-risk pregnancies, and I was going to be staying in the hospital with one of them. And their obstetrician was pushing the vaccine. And so they, in turn, told me I should consider it. And I reluctantly got it because I didn't know enough and I didn't want to harm these new babies.
I understand. So what happened after the first one, the first Pfizer shot?
The first Pfizer shot made me very ill for over 2 weeks. Just like the worst flu I could ever have imagined. Body aches, fever, trembling, and just that kind of thing. I couldn't eat, just felt very, very sick.
And you knew that was from the COVID shot?
Absolutely.
But you still went ahead and had another one?
I did, because I thought that in order for it to work and protect the babies, because that was my main concern, that I had to finish the series.
So what happened after the second one?
I was still sick again, and after that, it took another 2 months, and I was in the hospital actually with my youngest daughter after she had her C-section, and I noticed towards the end of our 4 or 5 day stay in the hospital that the top of my right toe on the left side was numb. No apparent reason, it just was numb. And we ended up leaving the hospital and going to her house for another 4 or 5 days, total 9 days. I only had 3.5 hours of sleep, and I started to feel sensations of tingling on the bottom of my feet, and it just started to escalate. I couldn't understand it. I was very sleep deprived, and I felt like I had to leave. I couldn't help my daughter, so I left and went home and slept for about 2 months with just getting up to go to the bathroom, very minimal eating, and I really didn't really talk that much to family, very minimal.
Did you go to a doctor? Did you get any help? Is there anyone, because it must have been worrying for you. The husband, I presume, is sitting right next to me right now. Why are you sitting over there?
This is her story.
Okay. I kind of were interested in what it was like for you as well, because you also took to...
I did.
Yeah. Okay.
Hey,
So
you're welcome.
So you're lying in bed, presume you're helping her. And
Yeah, so what happened was I had a surgery on a herniated disc a while prior, and I reached out to the neurosurgeon and I thought, could this be coming from that? And so that was the beginning of a long stretch of doctors. And they did an MRI with contrast. They had me take ibuprofen, lay on my back for 2 weeks, literally. The MRI came back fine, so they sent me to a pain management doctor and they started me on gabapentin. The pain management doctor referred me to was it the pain management? One of the doctors referred me to a neurologist, and I just started on this long quest. I had several different kinds of medications. I tried the ibuprofen, I was on the gabapentin, several different dosages. Then they switched me to Celebrex and Lyrica. I had horrific side effects. I was seen at chiropractors, a TENS machine, massage, physical therapy, occupational therapist. I saw a whole nother set of doctors because that was at the Mayo Clinic. And then I went to Barrow Brain and Spine. I saw for a second opinion. And I must have seen at least 4 neurologists by the time I got a diagnosis. I had spine injections, wrist injections. I saw a rheumatologist. I had EMG tests. I had more MRIs of the rest of my spine. I had a tilt test. I tried everything. I reached across the country for doctors to help me. And during the time my symptoms worsened, I went from just the numb toe and the tingling to buzzing all over my body, bzz, 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 and tingling vibrations. I had this sensation in my hand, like a webbing, like the shape of a triangle that was separated. I had wrist pain, elbow pain, joint pain. It went up my legs. If I walked, if I had any movement, it went all the way in the groin area, across my face. Sometimes it was just my lips, it was my hands, and it just never stopped.
Was it like pins and needles or just way worse?
It was like pins and needles. Sometimes it was more mild. It was different types of sensations, and I also had a loss of balance. I couldn't even hold a pen. I couldn't pour water. I ended up pretty much bedridden, and that lasted 14 months. I finally got a neurologist who did a skin biopsy where they take 3 pieces of skin on the one side of the leg, hip above the knee and above the ankle, and send it away. And then he finally said, we have a diagnosis of small fiber neuropathy. I said, great, what was the cause and what's the treatment? And he said, well, there is no cause. We don't have a treatment. You're never going to get better. You're only going to get worse, and you'll always be on medication. And I mean, that wasn't acceptable for me. So the fight continued. I was able to get an appointment with Johns Hopkins and traveled across the US, but couldn't take that appointment because my husband lost his job and our insurance wasn't in place, so they did not see me. I actually asked if I could do Mayo Clinic at the other location in Minnesota because the one that I currently went to, they just said I was fine. Everything was fine. Every test was fine. And they denied me to go. And I did, I was recommended to go to a PTSD program to be interviewed to see if they could help me because this must be coming from anxiety and stress. I had a DEXA scan, and the scan showed that my bones were osteoporosis to a 96-year-old because I couldn't do anything. I was afraid to be home alone. I didn't want my husband to go to work when he, got another job. I couldn't go to the grocery store. I couldn't do anything. And if we did have family over, I did sit in a chair with my legs up with special shoes and socks for cushioning. It would take me at least 4 days to recover, to just bring the sensation down. And then I decided, you know what, I have to try some natural things. So I went on this tangent and I saw an acupuncturist, a holistic doctor. I did the Wim Hof breathing techniques where you try to hyperventilate to clean the air out. I did cold water, 50 degrees was our swimming pool, and I went in it for 10 minutes at a time every day in the winter to try to bring down inflammation. I tried manipulating my circadian rhythm. I stood outside and I watched the sun rise. When the sun went down, we didn't turn the lights on in the house. We had candle lights. I got rid of all Wi-Fi at night, got rid of everything in the bedroom, no television, no EMFs. I started meditation. I put black light shades up and had an air purifier, which also worked as a noisemaker because I was so stressed I wasn't sleeping well. I got a Berkey water filtration system to try to get rid of fluoride and other things in the water. I got rid of fluoride in my toothpaste. I mean, I I tried everything. And I had something coming up, a blood test for my cholesterol. And I knew that I could bring my cholesterol down if I changed some of my eating. And so I did. I went to a whole food plant-based eating. And the 3 weeks later, I got the blood test and I noticed I could move my hips. I could, something was going on with the inflammation was coming down and I was starting to heal. And so I just kept on that. I flew to Santa Rosa, California, where I checked into the True North Health Center and did a medically supervised water fast for 14 days. I did partial juice and water and, went home and just kind of waited and continued. I went gluten-free, salt, oil, flour, alcohol, sugar-free. And over the course of this past year, I do have about 90% of my life back, but I still have the sensations. I lost that almost 2 years of interacting with my grandbabies, these new little babies. I was supposed to be one of their caregivers.
Should we look at some of these?
Yes.
You can carry on talking, I'll just put them up.
So that picture is right when I noticed that my toe was numb in the hospital with the grandbaby. And you could tell that I wasn't overweight and, I was tired, but that's about the time that I noticed that. The next picture is when I went home and just slept for days and weeks and months. I just slept and slept and slept. And my dog was just with me and it was not good.
All right, let's take the next picture.
This picture is one of many trips to get spinal injections. I had to be in a wheelchair. I couldn't walk well, and that was probably the second or third one. That's how I got to interact with my grandbaby. And you can see there's a pillow between my legs because I couldn't have them bent. I couldn't cross my feet or my toes. Everything would be heightened. It was almost like someone was taking a volume from like a car radio and turning it up if I walk around. And just out of bed, that was pretty much how I could, be around the house. I started drawing, and I've never had an art class or anything, but I started to draw once I could get some of the momentum to hold a pen, and that was me trying to express some of the sensations that I felt. And that was excluding the face. I also had it in the face and on my lips. That was me very medicated, pulling myself together for my mother's birthday. You could see I'm wearing soft shoes and I'm wearing socks because I was trying to be able to stand up. I'm hiding my hand because I was in a brace and I'm very heavy, my heaviest, because there was no mobility and I was on tons of medications that were doing absolutely nothing. And this last, so this is the circadian rhythm. To the best of my ability, I would just tried everything. I mean, leave no stone unturned. And that was when I brought all the babies' stuff to the car. And that's, you don't see me, but that I pushed to the car because we were checking out of the hospital. And I realized I have this weird buzzing, tingling feeling in my feet. That was when that happened. And, these are some of the solutions they gave me. Wrist braces and elbow braces, and telling me to sleep with my arms straight because they really didn't have any clues. And this is just what's printed of some of my medical records. It was a place that I was very alone in this space. I had no one to turn to. I, at that time, had never heard of vaccine injury. I asked all my doctors, could this be from the vaccine? And at the beginning, they said absolutely not. And over time, I got some of them to say, well, it could be. And then someone else said, well, even if it was, we'll never know. You can't prove it. And then I was also told by a final one that you won't know for 20 years. So I'm really angry. I'm really saddened. this is not gone for me. I still feel sensations and have trouble and work on balance and work on being my best self. I'm afraid that it could come back without any warning. And, you know, there wasn't any government or anybody that pushed these vaccines through my daughter's doctor, through the news media, through, you know, the government, through our president, through all of these sources. There was no one for me to turn to that was going to say, okay, I understand, I hear you, this is something we're going to walk through together. I was completely isolated and left alone, and those doctors, they went home at night. They went and dealt with their families, and they didn't think about me. I was a number, and at least that's how I felt.
Has this whole experience made you start questioning the whole vaccination schedule?
I stopped watching news media. I don't take any vaccines whatsoever, never again. I will not. I have to really be like probably taken away in a stretcher, unconscious, to go to the doctor. I am so turned off about the whole thing and what everybody is standing for. I do want to say that I believe that it's not necessarily the doctor's faults. They aren't trained properly and they weren't ready for it. And I want to give them the benefit of the doubt that there is a place for them. And there have been times that they've helped me with things. But when they don't know, they shouldn't just leave you isolated on an island alone. I sat in bed and told my husband, although I am not suicidal, I don't want to live anymore in this body. I mean, the sensations nonstop, like 24/7, and not being able to understand it. There was nobody to tell me what was going on in my own body. I'm so grateful that I am still here, but it's a terrible place to be. And I really appreciate this space to be able to share, because if you're watching and you feel the way that I've expressed that I've felt, know that you're not alone and there are other things you can try.
Do you have a place where people can follow you?
I do. I just recently started a YouTube channel just to show people how to eat whole food plant-based, and it's on YouTube at the Jennifer Diamond.
Is there anything else you want to tell the people?
Just don't give up. There, believe it or not, can be hope. Try something new. Go outside of the standard and see if some of the stuff that I shared with you might work for you. And just know that you're loved and you're not alone. We're all in this together. So I'm sending big love to everybody.